let's see, what do I want? Um, sorry, I just blanked on something. Is there a chance that your brain fog is partly due to an undiagnosed TBI or traumatic brain injury? When I was in medical school, I had a very, very great demonstration that was put on for me. I was called to the front of the room, and I was the what do they call it? Brain fog. This is called brain fog. Right here, right now, we're seeing it in this very second. I cannot remember the name of what it's called when you're taken up to be the example of something. I was like the demo person, but I know there's a better word for it, and I can't find it right now. So this is brain fog in action. Just letting you know it's real. When I was in medical school, I was called up by my professor, Dr. Shipley, and he sat me down and he said, "Have you ever had a traumatic brain injury?" And I'm like, "No." He was showing us how we can be better physicians if we do a better job asking questions. And then he went on to say, "Well, have you ever fallen out of a tree?" And I was like, "Oh yeah, I fell out of a tree." "How about off a bicycle?" "Oh yeah, there was a time I was at Brad Bailey's and I was going down his driveway. My front wheel got stuck in a rut and I went flat on my face and I was taken to the hospital and they did a bunch of x-rays." And then he went on to ask a whole bunch of other questions. "Did you ever fall?" It's like, "Oh yeah, there was a time that this guy who I kind of had a crush on in 6th grade pushed me off the counter because I beat him at chess and he was really pissed off at me. Hurt my feelings and it hurt my head." You begin to start to realize that, oh my gosh, I had all this brain trauma and I never thought that I had a TBI. How about you? Have you ever hit your head? Did you ever fall off your bike as a kid? These can be setups for having glial priming in your brain that can be part of having a pattern of traumatic brain injury without even realizing it. I spoke before in a previous video talking about how our microglia in our brain can be in an activated or non-activated state. Once we've had some kind of traumatic impact to our brain, those microglia are set and ready and on alert. They have been primed. They are ready to go active and to get into this hyperinflammatory state where they're willing to start munching down your neurons at the slightest insult. And the biggest mistake that people, or I'd say it's not even a mistake, I'd say it's a misunderstanding, it's a lack of information that most of us have, including physicians, is that it's not just physical trauma that can cause this traumatic brain injury in your brain. It's not just a head bonk that primes these microglia and makes them so that they are ripe and ready to be activated at the next significant insult to your brain. It can be from a chemical exposure. I knew a chemist where they had an accident in their lab and that chemical inflamed his brain. It can be from a viral infection. It can be from a bacterial infection. It can be caused by too much trauma in your brain. This can be a stack up of those little T's that stack up in your brain, or it can be from a big trauma, from PTSD. And those of us that have had multitudes of these over the years, you can begin to understand how our brain can be set up to be in a state as if we've had a current acute traumatic brain injury. And so I want to introduce you to this concept, and I'm going to go through a protocol that I've used for my own family members. And none of this is meant as diagnosis and treatment for you. I want to give you an idea of what is possible out there so that you know that you can create and discover the tools that are right for you so that you can take action to get your body back into balance. Be sure to talk with your provider to see if any of these are a good fit, because some of the things I'm mentioning may have interactions with medications you're on or not be a right fit for you. So, and I don't want you to have any problems from them. Unfortunately, I have had way more experience in treating TBIs in my family than I wanted to. My child, by the time he was 12, had five concussions. So we got really good at knowing what to do when he got a concussion, and he got really good at understanding when his brain was triggered, which honestly is a really important thing for you to do too. I know when my brain is more inflamed and when it's not. I have certain subtle signs that I now recognize as being my brain being a little bit more on fire. And when that's the case, then I go through some of these very same therapies I'm going to share with you here in a minute for myself, or I begin to do something that I know is going to help decrease that brain inflammation. So one of the very first things that you can do, and this works for people who have acute inflammation, like you literally just got hit on the head and you're dealing with some kind of brain inflammation. It also works really well for those people who are coming in who have long COVID, myalgic encephalitis, or some other form of something that's triggering inflammation and brain fog in the head. So here's some of the things I would consider. You may not need to do all of these, and there may be other things out there you can do. I just want to share what has worked for me in my clinic. So I divide things up into what is it that you can do and what is it that you can take and what other resources do you need. So what can you do? So first of all, you gotta rest. It's tired. Once your brain is in an inflammatory state, it's like that ankle that has been twisted and sprained. It needs to rest. You need to rest so that you can heal. When you first have an acute injury, if you can do radical rest, just radical rest, and stop and just go to bed, go to the couch and cover your eyes, because your eyes bring in so much stimulation, so much light, so much information to your brain. It's a lot. Our brain is spending a lot of energy cutting things out so that you can focus. And being able to just have that radical rest is going to be huge for you to heal. And then no screens. I know I'm the meanest mom on the block, right? It's like no screens, no screens, no screens for the kids. But this includes us as adults, which is hard. A friend of ours had a concussion skiing last winter, and he didn't realize that he'd had the concussion until a couple days later. And we had a chat, and he was like, no screens? Like, what if I just work on my novel a little bit? I'm like, no screens, dude. No screens. It's not cool. The screens are so stimulating to our eyes and to our brain that it won't give your brain a chance to heal. What if you sprained your ankle and then you just went out for a light jog? Would you do that to your ankle? No, you wouldn't. The only way your brain can let you know that it is inflamed, it doesn't have the same nerves that other joints and places in our body have. So one of the ways it can only tell you that it's inflamed, it needs a rest, is to give you a sensation of not being able to think very clearly, or maybe being more emotionally reactive. So make sure that you have no screens. What can you do? What do you do without a screen, right? Well, you can listen. You can listen to audiobooks. This is a great time to listen to something just on Audible or some other device. Art, you can draw. So if you have a low lit kind of space and you want to do some kind of art project, that can be very healing and very great. Again, a sign that the audiobook is too much or the art is too much is if you start getting a headache, if you start having, if you just start feeling more tired, if you start feeling irritable. These are signs that your brain is sending off that you're doing too much. Now, why did I say headache when I just told you that the brain doesn't really have nerves inside of it? Well, the pain from a headache actually comes from the vascular system, and it's a little bit more complicated about how that kind of inflammation causes a headache. But just trust me that there aren't nerves inside your brain that are sending pain signals out to you. All right, so the next things that you can take. This is a long list. You may want to experiment with all of them. You may just want one or two things, and there are other things on this list. It's not comprehensive, yet these are sort of the golden nuggets. Vitamin D, high dose vitamin D has been shown in the literature to help decrease that brain inflammation. Progesterone, even for men, progesterone has been shown to help decrease brain inflammation in acute trauma. I have used this for some people who are coming in with long COVID and have brain inflammation, where we experiment to see if progesterone for a few weeks or a few months can help decrease that brain inflammation. Sometimes we need to do a higher dose, like 200 milligrams is a dose that I've used frequently in clinic. Magnesium threonate. Magnesium is one of those elements that a lot of us are deficient in this country. And there are different forms of magnesium, and you might want to use a different form for different things. Why magnesium threonate? Magnesium threonate helps decrease those primed glial cells. It lowers what's called their action potential. This is where, if we talk about there being a forest that's ready for a fire, where it's dry and it's hot and it's windy and it doesn't take much of a little spark to create a flame, that's when your glial cells are primed and ready to be inflamed. What this magnesium threonate does, it's like, oh, thank goodness it rained. Like it rained a little bit and it lowered down that action potential. Those microglia are not as ready, as willing to take action right away. So when our son would go sailing, one of the things that I would give him is magnesium threonate, because I know if he got head bonked again by a boom coming across, he would be less likely to have such a strong reaction the second time he got hit. Turmeric is a super powerful, curcumin in there is a super powerful anti-inflammatory, as is frankincense. Frankincense is one of those essential oils. If you get medical grade, it can cross the blood-brain barrier, and it's been shown in the literature to help actually with neuronal development, and it's an anti-inflammatory as well. Chamomile is one of those plants that's also extremely anti-inflammatory for the brain. You can use it in an essential oil form if, again, it's medical grade, and you can also use it in an herbal form. And then quercetin and bromelain. This can be nice to use to get that inflammation down. This is something you would want to take on an empty stomach. If you take it on a full stomach, you're not going to get the same anti-inflammatory impact of it. This is something that personally I've taken when I first wake up in the morning. I take my electrolyte, my salts to help balance out my partial orthostatic tachycardia syndrome issues. And then I also take the quercetin and the bromelain in the morning, first thing with a big, huge quart of water. And that's one of the ways that I've been working on my brain inflammation personally. Okay, so who is it that you might need to confer and see in order to work on this in a deeper level? So first of all, you want to talk to somebody who knows how to prescribe and deal with this kind of stuff and help you to be sure that it's the right fit for you. The other thing is check out an optical neurologist. These are opticians who have gone to school for neurology as well. They are surprisingly available and also surprisingly divergent in how they practice. So have your due diligence, go to see somebody who's already worked with somebody who works with TBIs and they've gotten good results back. But this to me was like night and day. One of the big mistakes I see people doing when they're treating a TBI, and especially when it's our kids, and this is kind of hard to realize that we might be doing this, but your child misbehaving after they've had some kind of a TBI is not that kid being bad. It's that kid saying, my brain is screaming at me right now. It is screaming at me. And all I can do is freak out because I don't know what else to do with all this energy. So please, if you have a kid that either has a chronic disease, chronic illness, and or they have had a head bonk and you know they're dealing with a TBI, or you suspect that they have some brain inflammation, don't assume that every time they're being irritable, crying, screaming, or resistant to something that you're doing, that it's a behavior issue, because it may very well be the only way that they can express to you what is happening inside their brain. And the same thing goes for if they're at school. And a lot of kids, I think, go back to school before they're ready, once they've had a TBI. I know with my kid, we really had to educate him as to the signs and symptoms that might be showing up in his body. And we gave him 100% permission to tell the teacher if he needed a break, either from the classroom or if he needed to come home. Because it's so important that we let these brains heal. It's so important. So please do educate your child, educate your teachers, and educate yourselves to know what the signs are if you're dealing this with your kids. And if it's you, you've got to be compassionate towards yourself. I know a lot of us are super successful and we get here by pushing through, right? It's like we didn't stop when other people did. We kept going, and there is there is a beauty and a strength to that courage to be able to do that in certain situations. Your brain inflamed is not one of them. This is a time to pay attention. You don't want to ruin this thing. These neurons, we are born with a certain amount of neurons, and they can make new connections. That's called neuroplasticity, and that's super important. But we don't really grow very many new ones as we age. So it is so important for us to take care of what we have. And if you are feeling brain foggy and you need to stop and rest, please stop and rest and heal and take the amazing remedies that are available to us so that you can get back to life living your fullest. Your brain will heal if you do the right things to help it along. When I got long COVID, my brain started to react in a different way to visual fields, as in, I started driving like a nervous, my son said I was driving like a preschool teacher, as in I was kind of nervous and a little bit, tentative in terms of my driving. And this, I think, was a real key because it's true. I was checking 4 times before I merged into a lane. I mean, I was just kind of anxious. I hated getting on freeways, and I used to be a really good driver. I found that what was going on was that my brain and my eyes were no longer in alignment. And this is super common with TBIs. There are other issues that can happen when you have brain inflammation that impacts your visual fields. And there are multiple therapies that these amazing practitioners can help you with. There are things called prism glasses. There are colored lenses. There are vision exercises you can do. And I highly, highly recommend, if you're dealing with a TBI, chronic or acute, or if you have visual changes and you know that's an irritant to you, that you go get this help. I think it's one of the most underutilized resources that we have out there for us, for those of us who are dealing with brain inflammation. So please go ahead. If you like this video, give it a thumbs up. If you have comments or questions, I would love to hear from you. If you're curious what one of your root causes might be that's causing you to have all this fatigue and brain inflammation, check out the quiz below. I'll see you in the next video.